Medicare Part B, what does it cover? And I'm going to go over that right now, so stay tuned. And I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. I can absolutely help you as well. We need to kind of go through piece by piece by piece to make sure we understand all this Medicare stuff as it's coming at us, whether we're turning 65 or whether we're still at work. We're already past age 65, going to retire soon. Pretty much everybody's going to come into Medicare at one point or another. If we make it to age 65, Medicare is going to be there one way or another. So we need to understand our pieces as we go in. There's some really big choices because there's different ways Medicare can go. Right now, we're going to talk about Medicare Part B and what does it cover and how does it cover? And it's really not that complicated. So when we take Medicare as a whole, really the foundations are Medicare Part A, Medicare Part B. That is the foundation of Medicare. Then you kind of can add things to that, whether it be a Medicare supplement plan or choose to go into a Medicare Advantage plan, but that is a different conversation. Right now, we're talking about the foundation so we understand how the inside of Medicare works. So Medicare Part B covers things on the medical side. So when you get your Medicare card, it's going to say Part A, it's going to say Part B, it's going to say Part A is hospital, Part B is medical. It's going to have a date on when they start. You want to make sure those dates are the dates that you want them to start. And when you look at Part A hospital, Part B medical, it's kind of right, but it's really not that broad. So Part B covers a whole lot more stuff than what you might think it does. So it does cover medical stuff. It does not cover hospital. When they talk about hospital, really what they're saying is the room and board part of the hospital, your semi-private room, your TV, your meals, stuff that happens in an inpatient hospital admission on the room and board side. Part B pretty much covers just about everything else. So it's important to understand how that's all going to function because Part B has a deductible. It has co-insurance. It has things that you will be responsible for out of pocket. And we don't want any surprises when we're coming into a medical situation. So we want to make sure that we have it covered. Another important thing to understand, Part B has a premium. You're going to have to pay for your Medicare Part B. Right now, the base premium is about $185 a month. And that is the base premium. It is income adjusted. This shocks people more times than I can count that they're expecting $185 a month and their Medicare Part B costs a whole lot more than that because they have income above the limits to keep it at that $185 a month. It's called IRMAA. It's income related monthly adjustment amount. And I certainly have videos on that. Make sure you look for my IRMAA videos so you can see if you make over 100 grand a year, you're going to want to make sure you know where you're going to fit in for your Part B. So a lot of times people get into Medicare age and they aren't necessarily retired and living on Social Security. A lot of them will still have income coming in, either self-employment stuff or investments or whatever it may be, where your income can certainly exceed what the limits are. And that Medicare Part B premium can go up as high as to more than $600 a month. So significantly higher. It can quadruple. And if it's yourself and a spouse, you double that. So it can be a really big surprise if you're not prepared for it. So understand the premium on Medicare Part B. Now, Part B also has a deductible. It's a very small deductible. Right now, it's a little more than $250 a year. So you pay the first $250 and then Medicare pays after that. And it generally will pay about 80-20, kind of like old time insurance, where it's going to pay 80%, you're going to be responsible for 20%. And that's where your decisions will come into whether you get a supplement plan to cover a lot of that stuff or whether you choose to go to a Medicare Advantage plan, which really takes you off of Medicare and puts you into a private insurance carrier's Medicare Advantage plan. If you watch any of my other videos, I would not do that. I would not choose to go into a Medicare Advantage plan. Original Medicare, A and B, is fantastic coverage. It doesn't have any roadblocks or hoops that you have to jump through to get things done. If you need something done and your doctor thinks this is the best way, that's generally what happens. With a Medicare Advantage plan, you have to ask for permission. You have to hope that they're going to pay for it. You got to hope it gets done in a timely fashion. It's just not something that I would want with my health care, certainly as I'm getting older and will be needing it more. So Medicare Original for me is what I would do. And that's what we do. We help people get that all set up. We find the right supplement at the right price for the right coverage and make sure that just as you do this, you don't have to think about your health insurance anymore. It just does exactly what it's supposed to do. No big out-of-pocket expenses. and just gives you peace of mind to be able to go to any hospital, anywhere in the country, any doctor that takes Medicare, again, without having to ask for permission. So back to Medicare Part B, this part of it, so it covers stuff like doctor's visits, specialist visits, outpatient. Again, medical services that are not room and board in the hospital fall under the Medicare Part B coverage. Medicare Part B is also your trigger when you come into Medicare. So if you are going to stay at work past age 65 and stay on group health insurance, I have videos on that as well. Make sure you watch it because there's some intricacies there that you need to make sure you don't mess that up. But if you're going to stay on your group plan past age 65, you do not want to sign up for Medicare Part B. Number one, it has that premium. It would cost you money and you won't use it. Number two, it is the trigger when you come in later so that you can choose whatever you want without any health questions. It gives you an open window to do the things that you need to do and set up the things that you need to set up without any questions. If you've already started your Part B prior to coming in, number one, you've been paying for it, which wouldn't make any sense. Number two, you no longer have that open window. You'd have to be in good health to be able to choose some things. People could say, or insurance companies could say no if you're wanting to get in certain types of plans. So if you're going to stay on your group health, do not start your Part B. When it's time to come off your group health, that's a whole nother thing. You have to show that you've had that group health insurance so you don't have a penalty on your Medicare Part B. But again, not complicated. And that's what we do. We help walk you through all this stuff, make sure we get all your pieces in the right places, get it set up the way it's supposed to be done. And then again, no worries going forward. So I hope you'll let us help you. Just give a call. Visit my website, MedicareOnVideo.com. We will email you a quote on your Medicare supplement stuff. There's no sales involved. There's no pressure. We just do what's in your best interest. So I hope you found this helpful. Have a fantastic day.